Thanks so much, Izzy. Yeah, so my name is Breanna DeLeon. She just mentioned I'm one of the co-leads for the East and Southern region. I'm at the University of Pittsburgh. I study HIV prevention for urban natives, and hopefully we'll roll into medical school after that if Dr. Martinez or Dr. Owen accept my application. Yeah, I can go ahead and pass that over to Ava, and then we can just continue on with the other students as well.
Hi, my name's Ava. I'm from the Choctaw Nation of Oklahoma. I'm also from Oklahoma. I just graduated from my undergrad last year from Brown University, and I got my degree in public health. And now I'm here in Wy'east at OHSU.
Yeah, and hi, my name's Mateo. I'm from the pueblos of Pickeries, Santa Clara, and Cochiti in New Mexico. I'm also in the Wy'east program, and I went to Dartmouth for undergrad and also graduated last year. So it's nice to speak today.
Hello, everyone. I'm Braden Wines. I'm Muskogee Creek from Oklahoma. I am from California. I graduated with Ava last year at Brown University, also in public health, and I am part of Dr. Martinez's new Huigadec Tribal Health Program. I'll pass it on to Ayana.
Hi, my name is Ayana. I'm a part of the Hui'egatuk Tribal Health Post-Bacc program. I did my undergrad at Stanford with a major in human biology. And yeah, thank you for having me today.
Hi, my name is Molly. I did my undergraduate and master's degree at Arizona State University. I participated in a post-bac program this summer for the Native American Pathway Program here at Mayo Clinic, and my tribe is Comanche.
Okay, everyone. So we can just jump right into the questions. So the first question is, getting to know a little bit more about your post-bac program. So say a little bit about the school you're currently enrolled in or the program that you just completed. How was that program structured? Who did it serve? And what sort of educational content was delivered that was helpful to you? Anyone can go ahead and start.
Yeah, we can start. We're currently at the Wy'east program at the Oregon Health and Sciences University. The program mainly targets students that have graduated from their undergrad, have all of their pre-med classes completed, but have either completed the MCAT or have not completed the MCAT. You can be in either category.
Yeah, and then you're once you reach a certain threshold for your score, you can get conditional acceptance to OHSU. So that's what me and Ava are doing for the program.
Yeah, so you can complete your MCAT during, it's a 10-month program. So we started in September, September. And we both already had our MCAT scores done and had already taken it. And several of the other people in our program, there were 8 people total this year, ended up taking the MCAT last month. And actually we have 2 people taking it tomorrow as well. So we're
hoping they get in. Yeah. And then in terms of like the structure of our program, we kind of do a mix of what we call like foundations courses that are like science, biology, genetics, and also physiology. And then we do pop health or population health. And then like we kind of throw in some cultural classes as well. We call those like academic skills and wellness. And those are like on Fridays, and we do cultural activities and stuff. So yeah, we've been doing that for since September.
Thank you. Yeah, Braden, do you want to, or Ayana or Molly, anything that you want to talk about?
Yeah, I'll try to cover the basics for Huigadec. So this is the first cohort this year, but the structure has been similar to that of Wy'east. 10-month post-bac program also started, I think we started in August or September, kind of split up into cultural skills and learning, and then classes depending on what you needed. So for this program, prereqs are kind of individually based. and they help you take those classes as needed, so they're not as they're more individual. And then lastly is getting your MCAT score. For this program, you don't need an MCAT score ahead of time. They give you resources to study for that, and then you take it and get a certain score. Once that score is reached, then you have what's called conditional acceptance into UC Davis School of Medicine. Once you get your scores and a certain GPA, then you get to matriculate into med school. Ayana, let me know if I missed anything.
Yeah, I was just going to add, we also have a lot of cultural activities included within our program as well. And we also have gotten the chance to do a lot of job shadowing as well at local IHS clinics in the area. So that has been really great as well.
And Molly?
Hi, so the post-bac program that I participated in was a little bit different. So Mayo offers a program, it's the Native American Pathways Program, or NAP. It's a 5-week virtual summer program. What's nice about it is that because it's virtual, it can incorporate people from all over the United States. But some of the topics that included was like personal writing, mock interviews, community informed clinical simulations. There was a lot of exploration in bioethics and a lot of community-based team building that was incorporated into that program. They did provide an MCAT prep course. It was through the Princeton Review, and it was about 66 hours of prep, but it came with a lot of like MCAT testing and all kinds of really helpful resources.
Thank you. Yeah, very interesting programs. And I'm also wondering, and I'm not sure if you all knew, but the programs that you all went to, are they specifically for students coming from federally recognized tribes, or are there any like state recognized or even people from unrecognized tribes at those programs?
I think it's just federally recognized tribes.
Yeah.
I think ours expands to California state recognized tribes. It could be all state recognized tribes, but I would have to ask Dr. Martinez.
I believe ours encompasses all state recognized and federally recognized.
Thank you. All right, and then the next question. So, you talked about this a little bit, but what kind of culturally based supports are you all receiving from this program, or did you receive if you've already left them? And did you have to go and seek this out, or was this provided immediately once you started the program?
Yeah, so our program has actually been really supportive in keeping us culturally engaged. We've been doing a lot while we've been out in Humboldt. So for example, in the fall, we learned a lot about the importance of acorns and huckleberries for California Native communities in the area. And we actually like physically went out gathering. And all of what we gathered was used to support local ceremonies for tribes, which was super awesome. Also at Cal Poly Humboldt, where our program is at, they have a food sovereignty lab. And we do a lot of work with them, such as like the acorn and huckleberry picking and things like that, and also other workshops. We've also got the chance to attend a lot of like local ceremonies. A really special one we got to see was the Hoopa flower dance, or the coming of age ceremony that they have. Um, Also healing ceremonies like the brush dance. So that has been really cool. And I feel like it's been really helpful for shaping our understanding of healing and medicine within these communities. So
Thank you. Yeah, Braden, do you have anything to add to that
No,
experience?
that was perfectly well said, Ayana.
Great. And Ava and Mateo or Molly?
Oh, I was gonna say, right from the get-go, my program provided a lot of culturally based support every week. And something that I really enjoyed from my program was we had a cultural grounding session where we would sit with some tribal elders or elders in medicine. And a lot of our conversations were guided kind of by the energy of how people were feeling. We did summaries about things that we had learned through the week and how it carries over into some more holistic healthcare approaches.
Yeah, ours is pretty similar, where we have once a week where we would either do academic skills and wellness, or Indigenous wellness, and what was
Yeah,
that one?
and we would have like an elder in residence on those. Like today, actually, we did Pendleton heart making. And we also had a potluck where students brought in like food that like from their tribes. And so we do that kind of thing like almost every week, or we have like just activities with like a guest speaker that comes.
We had basket making, we just did beading, do potlucks. It's very integrated. Even our lectures have specific details about, we did like our most recent lecture was the kidney, and we talked about the prevalence of diabetes in Native communities. So everything feels pretty interwoven. Also, there's like a physical space here at the medical school that we're actually sitting in that is like the Native American space. So it's not, it doesn't feel like this afterthought, like, oh, the community, we have a community, and it's just this like abstract thing. It has like a physical space that people are here every day that you can talk to, that we all know. And it really is a tight-knit community here, I would say.
Yeah, and we also have a garden down the street too. So we got to visit that, and it's also just open for anybody to go visit.
Right, yeah, it's an excellent follow-up question that I have for you also. How does that culturally based support, I guess, how is it influencing your success in the program, or, you know, your passion for the field that you're going into? Has it been helpful or supportive?
I would say for me personally, coming from an undergrad that wasn't in a place physically where I wanted to practice medicine eventually, so I want to practice in California, having the opportunity to engage with the culture and tribes of the California region has been immensely helpful, especially in guiding the medicine that I want to practice in the future. Knowing exactly the cultural needs of California tribes has been huge.
I think for me, it has been really nice to kind of have that cultural support as just something to kind of keep me level-headed as I'm like going through this journey to medicine, to always have that there for me. And then also a lot of what we're doing is learning about just cultural aspects of medicine, and how that can also be integrated with Western methods of medicine. And I think everything that we've been doing is definitely going to apply in some way, especially if you're working with Native communities wherever you may be. So I think that's something that I really enjoyed, and I think is going to be important too once I become a doctor. So
I have to say that the cultural support has been overwhelming. I think one of the biggest difference, and this kind of goes to one of the questions I saw in the chat. When I was in my undergraduate, I felt like I was just a number, and I didn't feel like I had as much support as I could have from my school. It was available, but I didn't always have it from time to time because I just felt like a little fish in a big pond. But when I started doing my post-bac program, one of the best things was that cultural support. It was constant, it was reassuring. Whenever I had problems and needed to talk to someone in the program, whether it would be a tribal elder or a colleague, they were always available. And that kind of community you don't really get from a lot of other places. And that was something I really appreciated.
You want to go?
I think kind of going off what we were talking about earlier is that I think all of us traveled here. Like none of us are from Portland or from Oregon even. So having the community and the support that we do have has been so, so wonderful. Everybody's been so welcoming. And it's not even just the staff, it's also the other people that went through Wy'east that are now medical students here that are just like around the building. We talked to Mary yesterday, who talked to us about like financial planning for medical school. Even I think I remember talking to Jasmine, who's now a resident. She
Mhm.
completed the entire thing, and now she's a resident in, I think East Portland.
Yeah, and it's kind of nice to have like there's continuity in our program where there's like a lot of different, like at each level there's different people, so you like they can kind of share the struggles they went through, like doing like different parts of med school, which is kind of nice. And a lot of them have come back to the program just to like meet with us, or we met them like outside of the program, just like running into them or stuff like that. So I feel like it's so nice to kind of see that, because I've never really seen like people that are doing what I wanted to do, like laid out so nicely, and then
Yeah.
getting asked questions and stuff. That's really cool.
And we get invited, like match day is Friday, and they're like inviting us to go support the Wy'east scholars that are matching. So it's not just a one-way connection, it's also us bringing our own connection to the table.
Thank you all. Yes, that kind of also touches on the next question that I was going to ask you. So what factors did you all consider when choosing a post-bac program? Did you consider any other opportunities like internships or fellowships or even employment as opposed to post-bac, or how did you decide?
I can answer this one. Mine was a little bit backwards. I'm very much a non-traditional student. But with my post-bac, one of with other professionals in the field. So I was already working here at Mayo as an exercise physiologist prior to my post-bac. So when I had started it, I was looking to meet new people in the community, and maybe get some internships in some other areas different from what I had already done. And that seemed like one of the best ways to connect. Yeah.
For this question, I think it's kind of important, and I think we'll all touch on it a little bit, is this idea that there's a linear path to med school, which just isn't the case. And you know, everybody is different in terms of when they do certain things like the MCAT or how they tackle, you know, jobs or entering their gap year and stuff like that. For me, that was the case too. Um, I didn't even know I wanted to enter med school or have an idea about the programs that were out there into well into my junior year of college. And at that point, I was pursuing a completely different career that had nothing to do with medicine. And so for me, it was finding programs that could accommodate. And so, yeah, I could consider different jobs and things, but I wanted to find a program that worked well for me. And that was Huegadak, something that was able to guide my focus a little bit during a gap year. And I know we'll talk about that more later, but something that made sure that I was on the right track, even though it's not linear.
I can build off of that. So the first thing I just want to say about this is that my senior year at Stanford, when I was looking for opportunities like this, I was very, very stressed out. I felt unsure about a lot of things. I didn't know whether I was going to need to take like 1 or 2 gap years. I had a lot of gaps in my transcript that I needed to take care of, and I also still needed to take the MCAT. So really I was just I felt lost. I didn't know how I was going to be able to complete all these things while also financially supporting myself. And I did apply to a large variety of jobs in the Bay Area, but as I found out, the job market there is very competitive. And also, I didn't feel that a lot of the jobs that I applied to really aligned with my passions because I knew I wanted to find something where I would be able to work with Native communities, and kind of, have that cultural component that I really want to keep with me throughout, my time in medicine. So that's really what I was looking for. And so after all of this like rejection from jobs or whatever, I started searching the internet for post-bac programs and I discovered the Huegadak program. And yeah, this program has really been a great fit. It's supported me both culturally and financially, which is really what I was looking for. So
Yeah, and I think the Huwegeda program is very similar to ours in that it like kind of has a lot of structure to it. It has help if you're trying to take the MCAT again, and like get a score that you need to be accepted. And I kind of like heard about it because I did a summer program called NARI. And my roommate applied for it the year before, and I kind of saw him go through that process, and like he really loved having like a little like native community, and he was really interested in medicine. So we like talked about it a lot, and he recommended it to me. So when I got in, I just found that same kind of thing that he described, and the faculty were very supportive. And there's a lot of different things that keep us like on this path. I think if I wasn't in this program, it would have been harder to do it by myself, like kind of making sure I stay on top of every part of like getting into like medical school. And it's just really nice to have like a support system with you. So that's why I wanted to apply.
Yeah, thank you all. I love all of those responses. And so building off of that, like how do you envision your post-bac experience supporting you in the next steps? And has your program specifically communicated the, resources or the opportunities that they're gonna utilize to help you achieve that vision?
I think
feel, oh no, go ahead.
Okay.
Okay.
I would say for our program, they've definitely told us like if you need help like financially paying for like different exams or like STEP or getting different materials like UWorld, like certain things that you need. Yeah. So they have like the office here, like where we have classes. So like they're always like open to talk to for questions or anything.
I agree.
For Hawigaduk, it's really interesting because the program itself pairs directly with the UC Davis School of Medicine. And so they've kind of integrated the whole process. So they are holding our hand the whole way through as much as they can to make sure that we get where we need to be. They offer if you don't get your scores right away or in time to matriculate, they offer extra stipend support, extra MCAT resources, and even that conditional admission sticks around as long as you need it to get there. And on top of that, the staff of Huigadak work at UC Davis School of Medicine, so they're right there with you as soon as you matriculate. They're on the other side, making sure that you're doing everything you need to do once you enter Tribal Health Prime on that side.
Yeah, I would echo everything Braden just says. Um, I think that being partnered with UC Davis and the Tribal Health Prime program has been really special, especially since we've even gotten the chance to be paired with like med student mentors, which have helped us a lot throughout various things like MCAT, coursework, whatever we need advice on, they're always there for us. And also all the staff at UC Davis have been really supportive and helpful for us as well. So I'm excited to go to med school and then still have that support there.
So I kind of envision the Mayo Pathway program supporting me in taking my next steps towards medical school in a couple of different ways. So while I was in that program, they did provide us with a bunch of Indigenous educators and Indigenous providers. So it was really nice to connect with providers who had those same goals and cultural relations. I think that's really helpful. I liked that my post-bac was, if I'm not mistaken, it was free. I didn't have to pay money to get those resources, so that was really nice. And they really did a good job eliminating like barriers for Native students to be able to participate in that program. But I think the continued support from my mentors and continued support from my cohort that I'm still pretty close with will be what helps me the most going forward.
Thank you. And then the last question, and then we'll sort of dive into some of these questions from the audience. What advice might you give to a student who finds himself in a gap year, while they're either waiting to apply or reapplying or, having deferred acceptance? What advice would you give to a student?
As we've talked about a little bit, I would say that the post-bac is a great option to make sure that you have the support and resources and community that you need to push yourself to get new med school whatever gaps you might have in MCAT or classes or whatever. You could do that on your own, but it's a whole lot easier to have that support from a post-bac program. So I would definitely suggest doing that if you can during a gap year, but knowing that people don't and still get there is good to know too.
Yeah, I totally agree. I think number one thing would be doing one of our pathways, our wonderful pathways. But I also I have several friends. I have a friend that's doing AmeriCorps in her gap year. I have a friend that's a consultant. We have several people in our pathway that took several gap years before going to medical school.
Yeah, we have one person who did nursing. We have another person who was a dietitian. So we actually do have a lot of like non-traditional applicants who like eventually came back and were like, okay, I want to do medicine, and maybe it's been a while like since I haven't had classes like from in undergrad in a while. So it's really nice to like kind of get back into that like studying and like mindset, I guess, and also have support. So that way, like when you go into it the next year, you're like, not only are you familiar like with the location that you're gonna go to school, but you have like all that support and study skills.
My advice for a gap year, it kind of echoes what Braden said. Don't be afraid to do a post-bac program, or be afraid to volunteer or do extra things. I can honestly tell you I'm on my second gap year, and I just keep looking for more things to do to diversify my own knowledge and make myself someone who would want who like a good somebody who would want to be a really good provider. I'm always trying to learn new technical skills. Um, it's just I honestly, if I could, I would say I recommend a gap year. I think it's a helpful experience, truthfully.
I think I would definitely echo everything everyone has been saying. Um, I think in addition to that, I just want to say, whatever opportunity you're seeking out, make sure it is something that really is investing in your success, and prioritizes that support of you getting to medical school. If you get a job or whichever a post-bac program, making sure it's not like too over demanding and that you're able to fit in and be supported through the medical school application process or like MCAT studying, because it's really demanding, and having to juggle like a lot of other things can be really difficult if you don't have that support. So I think that, and then also finding something that aligns with your passions, whichever it may be, a post-bac or a job of some sort.
Thank you all. Yeah, no shame against a post-bac. My post-bac's coming up on year 7, and that turned into 2 masters and half a PhD. So take your time to anyone who's doing a gap year. Okay, we can jump into some of these questions here, and I think the first one is from Kristen Olson, and they said, what has been the biggest adjustment from undergrad to post-bac?
I think the biggest adjustment for me wasn't necessarily related to my post-bac. I think trying to balance like my work research and a post-bac all at the same time has been a bit of a challenge. Um, yeah.
Yeah, I kind of agree. I feel like the challenges I've faced, or like what's been the most different, hasn't been the actual classes. It's been more so like living alone for me. I've never lived alone. I lived in the dorms all 4 years of college, lived at home before that. So this has been like a new experience coming to Portland.
Yeah, I know. It's kind of like, and getting used to a new like place again.
Mhm.
I've never been in the Northwest before, so that was like a unique thing for me. And also like I think learning how to study for medical school is a little bit different than, or maybe it's not different, but like it's helpful for going into medical school, and it's a little
Mhm.
different from undergrad. So um I think that has been something I've been learning a lot about.
I think for me in undergrad, the resources and the staff, they treat you a whole lot differently. I think you have a whole lot more resources in a post-bac. As long as you use them right, they're there for you, and you just have to be like willing to do the work to use them. That was the biggest change for me. And also, in such a small program like this, it's really on you as an individual to make things happen. So if you're struggling in some way or feel like you're behind, you have the resources, but you also gotta let people know.
I think for me, the biggest jump from going from undergrad to post-bac is kind of what Braden was saying. Like you're in a much smaller group now, and you get a lot of more one-on-one support. Um, Also, we all live together in the same apartment and house, so that has been really great to just like have the other people that are in your program right there next to you, and you're all doing stuff together, struggling through things together, whatever it may be. So that's been definitely a lot different. Um, Also, I think I forgot to say this earlier, but I'm originally from New Mexico in the Southwest. And then I, of course, did my undergrad in the Bay Area. So moving to a place that was very different from either of those areas was an adjustment for me as well. So I think that was definitely something that I had to get used to living in a new area and being integrated into a new community.
Thank you all. And you definitely touched on the next question, which is how are you building community with your cohorts? Or, Molly, I know that you finished yours, but how did you build community in those programs?
How would you define community? Like connecting with my peers or more connecting with the like local area?
I would say both. How did you connect with the people in your program? How did you connect with the community? I think I heard some of you say that, you moved to different regions, like away from your, native community to join these programs. So how did you find people and find your place?
Yeah, so honestly, I'm still a little bit kind of navigating and finding my place. I connected a lot. So Mayo's program was all virtual, so I was able to connect with people from several different states, which was really nice because different tribes, different states, everybody has different cultural beliefs and attitudes and signs of respect and all kinds of nuances like that. But we spent a lot of time talking. There would be, like I said, during those cultural grounding sessions, we'd be able to sit and talk with each other about how we felt about the program, how we felt about life. I mean, all kinds of stuff. And that was one of the ways that I was able to connect was just honestly by talking. And we formed some really good friendships. And at the end of my program, we were able to, my whole cohort was able to go to one of the ACES conferences, so we got to do a lot of communicating and networking there as well. And then as far as the community goes, talking to a lot of the local elders was really nice. Um, I have found, so one interesting fact about my tribe is my tribe does not have a reservation. Um, Everyone's they're together, but very separate. So with some of the elders local to Arizona, they could be asked, who's your grandma? And they could figure out, what your lineage was based on who your grandparent was. And that was something that was different that I had learned with that area, whereas my tribe, it's just kind of like, it doesn't have that. So it was nice to be able to connect to them in that regard as well.
I think I know Ayana touched on this a little bit, but they shoved natives who like medicine in an apartment together, and obviously we were going to build a community from that. So it just having those like common threads was enough. But in the broader community as well, having the connection to UIHS through Dr. Martinez, that was huge. Making sure that we could connect with the community and shadow and see and build a sense of trust from us to them was great.
I think also, kind of building on that, our apartment is also located on Cal Poly Humboldt's campus. So we have access to Cal Poly Humboldt's Native Center, which is called ITEP. I can't for the life of me remember what that stands for. It's really long. But anyways, ITEP has like a little Native Center kind of house, and it's where all the Native students go to hang out, study. They have an ITEP club and they host a lot of activities and things like that. So we're always there too, studying, doing things, um, hanging out with the other Native students. So that's been a great way to have community. Um, and then also, we have a lot of like Native reservations and communities that are like really close by us. So I know we've had the chance a lot to go to different reservations for their community events and things like that. So it's been really great to have that available.
Yeah, I think for us, the community comes in part of that. We're here every day for class, every morning. So that builds a camaraderie, and we go out on the weekends and get pizza and beer.
Yeah. And if we have a small, like little cohort, it's just like 8 of us. So we like know each other really well. We just spend like time doing activities like outside of like class. And sometimes we go to like concerts or just like events in town or yeah, so it's been really fun getting to know like everybody in this like very tiny community.
I agree.
Thank you all. Okay, next question. Susan from the IHS is digging a little deep here. They want to know what happened in your lives that sparked the medical passion. Was it a mentor, speaker, or personal event that initiated your passion? You could take a second to, dig for that one.
I might just like copy and paste my med school essay here, but for me, it was a combination of things. I've always been driven by STEM and biology and always was interested in it. When I started at Brown, I thought I liked public health, and I do like public health. But when I started doing consulting, it wasn't enough. I did a lot of research on the side, and all my research was native focused, just given my background, and all the health problems and epidemics that I did research on and came to understand um, were some things that I wanted to were things that I wanted to combat. And so for me, that's what kind of sparked it was, okay, I'm not entirely happy with my current job and trajectory, but I really want to help solve these health problems in Native communities. And so that's that.
Brayden, we're the same person. Really, we are. I went to Brown for public health, and I thought I'd do some like, I really like statistics and I like research, and that's where I thought I would go into, kind of looking at health from this broader lens. And I do really like that. But our sophomore summer, I applied for a ton of internships, didn't get any of them. So I was like, okay, I still want to do something with my summer. So I ended up becoming a medical assistant specifically for the rural communities and rural clinics in Oklahoma. So I'd drive to different clinics every day, depending on if they had a nurse that was out on vacation or sick, and I'd fill in for them. And I did 3 months of that, and I was like, oh no, I really like individualized medicine. So that's what kind of sparked me into going into medicine specifically and not just public health.
Yeah, and for me, I think it was like a mix of things. Like originally in high school, I was kind of interested in like biology. And then when I went into college, I thought I was gonna do maybe engineering or biology, and then I chose biology and I started taking psychology courses, and I loved like learning about mental health. I loved like figuring out how the mind works, and also kind of seeing some of the stuff I had grown up with in like my pueblos, where the like mental health access is very like limited, or it can take like a long time to see like a psychiatrist or like provider. So I just thought like this is something I'm kind of like I'm really passionate about, and I can keep studying it here. So then I did like some more research and like NARI, which was like a summer internship for research, and I like kind of wanted to figure out how I could help my Native communities after that, because a lot of the people in that program were very inspiring. Like they really wanted to go back to their community and do work. Wasn't all necessarily like being a doctor, but I thought that's what I wanted to do. I wanted to be a psychiatrist. So yeah, that was my path.
I think for me, I'm just thinking about where it all started for me. So I actually grew up with a mom that has a physical disability. And so I went to a lot of doctor's appointments with her throughout my life. And I definitely got to see the different roles that doctors played in helping her heal and things like that. And I actually wanted to be a physical therapist at first in high school. And then I had a really good guidance counselor in high school, and she said, "You know what, Ayana? Like, have you ever considered going all the way, like to medical school? Like, I feel like you could do it. You should try for it." And so she was like telling me about different opportunities that I could apply for or whatever so that I could make that happen. And I think like having that little form of mentorship and just encouragement is like really what drove me to like pursue that and stick to it. So then I think through undergrad, I stuck with it. Like I really held on to the fact that this is something possible for me and I can do it. And then in undergrad, I really got interested in maternal and child health. So I did research and job shadowing with that. And that's currently my interest. So
Hello. So, Susan, to kind of answer your question, I didn't really have a mentor or a speaker or a personal event that really like struck me and was like, I'm going to go into medicine. I can honestly tell you, I've always wanted to be a provider, probably since I was 5. But I've always heard my entire life that that was something that was very challenging and maybe might not be something worth pursuing. So I spent a lot of my undergraduate and early teens working in jobs that still provided service because I did love to care for people and for different populations, but weren't necessarily directed towards being a doctor. So I worked at a pool and I was a swim instructor and I taught swim lessons to kids. I was a respite and rehabilitation provider for many years for kids and adults with special needs. Um, I worked in a lock shop. You know, weird things. And I never found that sense of enjoyment. I never lost that drive for always wanting to be a doctor. It's just always what I've wanted to do. So in my undergraduate, I was really into sports. I'm an amateur triathlete now. I thought I would go into physical therapy. So I started off doing a kinesiology degree and I did graduate with that. But I got into physical therapy and I kind of found out early on that it wasn't for me. I pursued a master's at ASU in exercise physiology, and part of the reason I did that was because it was a way for me to get my foot in the door here at Mayo. I knew they had a lot of internship opportunities and a lot of opportunities for connecting in the community. And since then, I've been working here. I did my Pathway Scholars program through them. I'm continuing to do research, and I've changed jobs once since then just to learn more skills, learn something different. And I'm going to keep doing it until I get in.